Today, the European Commission is fining the pharmaceutical company Teva for abusing its dominant position by delaying competition to its blockbuster medicine Copaxone. Copaxone is used to treat multiple sclerosis, a chronic and very serious disease of the central nervous system that affects more than 1 million patients in Europe. The Commission found that Teva broke EU competition rules with 2 types of abusive conduct, part of a strategy to hinder or at least delay competition from rival products. Teva held a patent on Copaxone for 20 years. As the expiration of its patent in 2015 approached, Teva used a tactic known as the divisionals game, a way of artificially extending the patent protection of Copaxone. As part of this game, Teva used 2 remaining secondary patents to obtain multiple additional so-called divisional patents with very similar contents. They filed these divisionals in a staggered manner, creating a series of overlapping patents around Copaxone. To compete, generic companies would need to file patent litigation to gain market access. And this is where the second part of Teva's game comes in. When potential entrants challenged the validity of a specific divisional patent before the European Patent Office, Teva then strategically withdrew that patent, often at the very last possible minute, to avoid an adverse decision that would create a precedent and hurt the remaining patents. For the Commission, this amounts to a misuse of the procedural rules of the European Patent Office. It forced rivals to make the same legal challenge again and again to remove the artificial barriers to entry that Teva created. It took until 2024, that's 9 whole years after expiry of the basic Copaxone patent, for the challengers to get rid of the last divisional in Teva's game. Now, Teva also launched a disparagement campaign, aiming at damaging the reputation of its rival products. They systematically spread misleading information, questioning the rival products' safety, efficacy, and therapeutic equivalence with Copaxone. This message was passed on to doctors, health insurers, and national decision makers for pricing and reimbursement of medicines. And this was despite the findings of the competent health authorities, who had previously confirmed that the rival product was indeed safe, effective, and therapeutically equivalent to Copaxone. These abuses of its dominant position concerned the markets of 7 member states, and it lasted between 4 and 9 years, depending on the country. Teva's conduct was capable of leading to higher costs for health systems in the EU. With today's decision, the Commission is sanctioning Teva's illegal behavior and ensuring that effective competition can lower prices and benefit Europe's patients and health systems.